Kia ora koutou katoa, nau mai, haere mai. Thank you very much for being here this afternoon for our stand-up. Today, New Zealand arrives at a key point in our pandemic response, and one which reinforces the value of what we have been doing for the last 12 months to keep COVID-19 at bay. Vaccination of our hard-working and dedicated border staff marks a significant step forward, a milestone that protects those at greatest risk of getting the virus and helping to reduce the risk of it spreading into our communities. Yesterday, 29 vaccinators here in Auckland completed a week of preparations by receiving the first COVID-19 vaccines in New Zealand. Today, we have kicked off the largest immunisation program in our history by vaccinating the first of our border workforce, a critical step in protecting everyone in Aotearoa. This is an important first step, and we continue moving through these first few days and weeks in a measured and stepwise way to make sure that all our systems and processes are solid. Next Monday, we'll roll out the program in Wellington and in Christchurch on Wednesday, before starting to vaccinate the rest of New Zealand's about 12,000 border and MIQ workers over the coming weeks. Once they've been vaccinated, we'll start vaccinating members of their households. The finer details of the wider public rollout of the vaccine later in the year are being finalised, and information on when and how people will be vaccinated will be announced soon. People from across the health system and many other agencies have been and continue to be single-minded in ensuring that the vaccination program will be a sustained success. In a rapidly changing environment, our system has had to be flexible in its response to deliver firstly on our elimination strategy and now on this vaccination program. I sincerely thank everyone who has been involved, and I'm going to run through some of the key groups. I want to particularly acknowledge the support of the New Zealand Defence Force, Ministry of Business, Innovation and Employment, and the teams at their managed isolation and quarantine facilities, the all of government team, a range of private sector partners, and of course our DHBs and the wider health system, including public health teams, our Māori and Pacific providers, nurses, doctors, allied health professionals, administrators, ICT specialists, planners, communications advisors, and of course organisational leaders. It's been a huge logistical effort getting to where we are today, and it's been done while our health system has continued to deliver a wide range of care to New Zealanders and maintained a successful response to the global 19 pandemic. Repeated trial runs of our processes and systems meant we have been able to deliver these first vaccinations less than a week after the arrival of our first doses of the Pfizer BioNTech vaccine. We should all be proud that in less than a year since our first confirmed case of COVID-19, we are ready to go with what will be the biggest single logistical exercise our health system has ever tackled. Today, though, is of course about our first group of workers who have been vaccinated. So I'm joined here to my right by Lynette Faiva, Drew Liafa and Lorna Masoi, who we will hear from shortly. They are border workers that were vaccinated this morning. And we're also joined at the end by Tracy Peterson, a registered nurse and one of our vaccinators. Also with us today, Dr. Nikki Turner, Director of the Immunisation Advisory Centre, and Puea Winiata, Co-Chair of the COVID-19 Immunisation Implementation Advisory Group. Alongside them, Dale Bramley, who's the Chief Executive at Waitemata District Health Board, and Margie Apa, the Chief Executive at the local DHB here, Counties Manukau District Health Board. And I'd also like to acknowledge my new colleague, Jo Gibbs over here, who is actually the Chief Operating Officer at Auckland District Health Board, but I've seconded her into the ministry to lead the operational aspect of the program this year. So Jo is someone who you will be seeing more of in the future. Their teams across the DHBs here in this Auckland region have played a massive part in the response and in the preparation for the vaccination program. I want to personally thank them for that, and both Dale and Margie will also be available for comment following our media conference. Now, you may be interested to know about current cases, and I can report that there are just 2 cases in managed isolation to report today, and no new media cases. A separate media release has gone out about the numbers from today. So, in closing, today represents a small but important step in a long journey. It's the start of what we might call a new chapter, but we still have a long way to go in the evolving COVID-19 story. We need to remember that this pandemic is the most significant global public health challenge in a century, and managing it will require all our efforts for some time to come. And even though vaccinations have begun, it's important everyone stays vigilant and sticks to the basics. Stay home if you are unwell and seek advice about getting a test. Washing hands, coughing and sneezing into your elbow, wearing a mask or a face covering on public transport. And also, please keep up the good work and use the COVID Tracer app to keep track of where you have been, scan QR codes and ensure that Bluetooth is turned on in your app dashboard. It's been great to see a significant increase in scanning over this last week. Now, if the research, good science and technology behind these vaccines seems highly sophisticated, it is. And we can have confidence in both the science and the processes that New Zealand has in place to ensure vaccines that we use here are safe and effective. However, in the end, our success with this campaign will be achieved in the same way we have achieved success with our response to the pandemic, by acting collectively and in each other's interests. I'm now going to hand over to Dr. Nikki Turner to say a few words about the vaccine and its safety, and then to Puea Winiata to touch on the Immunisation Implementation Advisory Committee and the work of our vaccinators. After that, we'll take a short moment to reposition our cameras, and I'll go and join our vaccinatees to ask them to introduce themselves, and we will have a question time. Thank you very much.
Thanks, Ashley. Kia ora koutou, I'm Nikki Turner, the Director of the Immunisation Advisory Centre at the University of Auckland, and our role in this program is that we do train the health workforce, educate, support the vaccinators and all the health workforce out there. I myself am an academic general practitioner with an extensive history and interest in vaccines internationally and locally, and it's my privilege today just to talk to everybody very briefly about this Pfizer BioNTech vaccine that we now have used within the New Zealand community, which is a really fantastic moment. In the last week or so, I've been in the privileged position of being part of quite a large amount of information sessions to hundreds of border and MIQ staff with many Qs and As, and also many of the health sector. And the questions that come back from everybody are pretty consistent. Will this vaccine be effective? For me, for my community, is this vaccine safe? And how come we got it so fast? So I'm going to briefly, in a few minutes, just cover those key issues, because I think all of us as a community combined want to feel secure about these answers about this vaccine. Now, firstly, I want to say that people keep saying this came too fast, but the clinical steps in the development of this vaccine, New Zealand has waited appropriately till we have seen all the clinical trial data, right from the early stuff through to the very large pivotal clinical trials, which are on more than 40,000 people. These are traditional when you develop a new vaccine, that you vaccinate a community and then you put what we call a placebo to the equivalent amount of people, where you give them an injection that does not have the vaccine, and in that way you can compare if the vaccine is effective or not. The clinical trials have shown very clearly with this vaccine that it's an incredibly high-performing vaccine. New Zealand is very privileged to have this vaccine. It's the best in the world. At the moment, the effectiveness data is around 90 to 95%, which translates to be that if you had 100 people given this vaccine, at least 90 or 95 of them, when they were exposed to COVID, would not get symptomatic illness. That's a very high-performing vaccine. Now, the advantage New Zealand is in is we were not the first country to run with this vaccine. We did not run under emergency procedure. We did not have high rates of death and dying in our community, and we're in the very useful position that we've been able to wait for a few months. This vaccine has now been used in millions and millions of people around the world, and we have really good clinical data, not just from the clinical trials, but actually from real-world experience. So we know already with the early data coming from Europe, from the UK, from the States, from Israel, that it is performing as we saw in the clinical trials. Is this vaccine safe for me, for my community? Well, what I'm really proud to say is the clinical trials, already we have very secure data on very large numbers. But now we also have real world experience. And just within the last couple of weeks, we have from the American Safety Monitoring data on more than 12 million doses of this vaccine given. That's quite a lot. And the clinical data is secure about the safety profile of this vaccine. We do know that it can cause allergic reactions. We are ready for that. Our vaccinators are prepared. All vaccines and all biological products cause allergic reactions. New Zealand is well prepared for that. The severe ones are extremely rare, and we will be prepared for that. Other than that, we know what this vaccine does. It can, for some people, give you sore arms, you can feel achy, you can sometimes get a fever for a day or two. For any of us out there who've had the flu vaccine or any other vaccines, we know what it's like. Sometimes you're great and it's sweet, and sometimes you can feel a bit achy afterwards and a bit miserable for a day or two. So we're ready and expecting that. And also, if you do get reactions after the vaccine, we know and expect that this vaccine is working. So we're confident about the safety data. The other thing that the Americans and the rest of the world are doing is they are monitoring background rates of important medical conditions, autoimmune conditions, immune-mediated neurological brain things, heart, respiratory. Is the background rate changed when we introduce the vaccine? And we can already say within the last 2 to 3 months that the American data at least is showing with these large numbers, there's nothing we're worried about with this vaccine. It is not causing any problems. So we're very excited about the safety profile of this vaccine. The other two common questions is, how come this vaccine's come so fast? It normally takes years and years to get a vaccine. Well, I have to say that the world got its act together in a way that we don't normally, and it's incredibly impressive that firstly we got the actual virus genomic details out very fast from the early data in China, and then the scientific world got together extremely fast. We had early development already from the SARS and the MERS outbreaks. We've got modern technology, and we have been able to produce vaccines by running things in parallel, processes in parallel rather than step by step by step by step. But I think the important thing for us to be aware of is that we did not shorten any of the important clinical steps in the process. The world did build big manufacturing plants in readiness even before if they knew these vaccines would work. They stood to lose squillions, but this pandemic's costing us a bit, so that's no surprise. So no, that's the reason why the vaccines have got here so fast, and we have not rushed the authorisation approval process. And the final point I want to make before I leave it to the people who have received our vaccine is, how will this vaccine help us? Well, firstly, we absolutely know it is going to keep us from getting symptomatic disease. Will it be able to stop us then, as being vaccinated, spread the virus from me to someone else? We are hoping it will. Some of the early data is looking promising, but we do not know yet. We cannot guarantee that this vaccine will stop me spreading to you. So we have to continue, for the time being, our border protection, our PPE, our social distancing, our hand washing, our staying at home when we're sick in the meantime. So I just wanted to finish up with saying, as a person with a lot of experience in vaccinology, this is an extremely well-performing vaccine. I highly recommend it. I'm very keen to get it myself, for myself as a frontline provider of protection and for my family. And I'm grateful for the opportunity to talk about the science today, because it's super cool science. Kia ora koutou.
Thank you, Ashley and Nikki. E mihi mahana ki a koutou I tēnei ahi. Nō reira, tēnā koutou, tēnā koutou, tēnā koutou katoa. Ko te Puea Winiata taku ingoa. I hail from Tauranga Moana, Ngāti Rangi Nui Ngai Te Rangi, and I am the CEO of Turiki Healthcare, which is a kaupapa Māori primary health organisation in Māngere and in Panmure. I also want to say that it's been an absolute privilege to be the co-chair of the Implementation Advisory Group, and the reason why I say that is that we have some great minds. The advisory group was put together mainly because it was an opportunity for the Ministry of Health to bring people together from outside of the ministry to talk about and share their experience of what this was going to look like in the rollout of the vaccinations in the community and some of the systems that needed to be put in place. I also want to say, and I was really sad yesterday that a number of them couldn't be at the facility yesterday. It was really quite a moving experience to see a cavalcade of vans coming down delivering the vaccine. And I know that the people that I've been working with in Wellington have such great heart for the work. They're not only experts, but they have great heart for the work. And I can't say that enough, because that's what's going to make this rollout really, really important. So they weren't there, but I cried for them, you know, and sent them texts to say that the Eagle had landed at the facility yesterday. I just want to also acknowledge that my team have been working in the MIQ, and I have to thank all of those involved in the hospitality at the MIQ, because they have done a superb job in making it safe for me and my team and the other people to work safely in that facility, and that's no mean feat. I'm here today after my little spiel, but I'm here today to talk to you about my team and the work that they've been doing today, and also the work that they're going to be doing over the next few days. We are an experienced kaupapa Māori health provider in South Auckland, and of course with that I have two Māori clinical leads, Dr. Lily Fraser, Dr. Katrina Kirikino, who actually got vaccinated today, and also Renee Muru Barnard, my primary health care manager. So it's taken a lot of us to get to where we are today, and I want to acknowledge the senior nurses that and the administration staff that have been working as part of my team in MIQ to deliver services. They actually had a lot of experience during the two lockdowns with going out into the community, vaccinating, doing COVID testing, providing kai boxes, hygiene, and a range of other services to the community during that time. So they come with a lot of experience vaccinating in a range of community settings. It's also meant that we're early adopters. We're early adopters alongside the DHB staff to trial the training, to get ready by using the COVID Immunisation register, the software that we're using. I can say that my staff have a lot of praise for the training around the vaccination, because it's enabled them to use their previous experience and to be up and go quickly to vaccinate the MIQ staff. I can also say that again, my staff have worked in community settings where it's been quite challenging at times, mainly because of the weather, because of the venue. And so what that has meant is that they were really keen to see what kind of software we would be using when we get to Tier 3, rolling it out into the community. And I can say they were very impressed, and it's very user-friendly. So the last few days, it's been practicing end-to-end systems, from the booking and people registering to get their vaccinations, to informed consent to the vaccination, and then across to the observation area where people will wait and just be supported, just to make sure that everything has gone well. So for me, in the primary healthcare setting, I'm now thinking about strategies. I'm thinking about how are we going to now capture the household bubbles, the whānau of these border and MIQ workers, because they're going to be next up. What are the sort of settings that we're going to be able to support whoever the provider is going to be, and to help capture as many people who want the vaccine at the next stage. So that's really important, but beyond that, I have to say I work in a number of networks across South Auckland. Māori providers are poised. they're ready to go. They're ready for training. They're ready to think about how they develop bespoke models to wrap around whānau, particularly those who have found it difficult to access services, any issues or barriers, we're going to be there. So what I want to say is that I've been told that we've got lots of doses and we've got enough doses for everybody in this country. We have tested systems. We've had the training and we've tested that. We've had a few little bumps that we've been able to manage really well, and people have wrapped around my team to ensure that everything has been really good. So we've got the end-to-end systems in place. But now we need to think about how do we engage whānau? How do we make a positive experience for them, particularly the next round with border worker and MIQ families? Because if they don't have a good experience, that's going to resonate with them. And where does that resonation go? It goes actually out into community, into other whānau. So we think that we've got the systems in place, but we also need to be thinking very carefully about how we engage whānau and how we make this a good experience for them. The other interesting thing for me, particularly during this time, is to think about how we work as providers with communications people. We actually need a range of bespoke messages to reach whānau that is going to make it meaningful for them so that they can make an informed decision. So lots of partnerships need to happen. So I want to thank you. This has been a really awesome experience for us as a primary healthcare service, and we hope to share our learnings as the whole sequencing framework rolls out. Kia ora.
Well, thank you, Nikki and Puea. I'm going to just give you a couple of minutes now to, I think you might need to reposition microphones, possibly cameras, and we'll move over to our important people over here, one of our vaccinators and our 3 who got the vaccine this morning.
Yeah.
Whakalofalahi atu. My name is Lynette Pfizer. I am part of the family support team at the Jet Park quarantine. Today I was the first MIQ worker to be vaccinated.
How are you feeling?
I'm feeling fine. Yeah, I've had that question asked quite a few times today, so I'm not sure how I'm meant to be feeling, but I feel normal, yeah.
Let's just go along the line, and I want everyone to introduce themselves, and then we'll open it up for questions, please.
Okay, talofa lava. I'm Drew Liafra. I'm the operations manager at the quarantine facility, and I was the second person MIQ worker to be vaccinated this morning.
Hi everyone, I'm Lorna Masoy. I'm pretty much an in-betweener in the operations and medical team at the Jet Park quarantine site. I was the third one to get vaccinated today.
Kia ora, ko Tracy Ahoy. I'm a registered nurse and authorised vaccinator at Turiki Healthcare.
Great. So I'd like to open it up for questions, and if needs be, I will help moderate the questions. But there might be some further questions here for Lynette.
Tracy, if I'd like to make this is a question to you. So you've had the training and now you're going to be going out into the communities and doing these vaccinations in the different tiers that you have to do it. But thinking about our whānau, and there's a lot of hesitancy still within our whānau, what are your feelings and what is your key message out to our kuia karaua and our whānau out there still on the fence?
It's about getting reliable, science-based information. And once we have that, and I think if our whānau have a good experience when they come, so for instance, the MIQ staff now. So when we're giving the vaccination, we're also trying to encourage them or give them accurate information so that they can take that home, because that's where it will spread. If they were comfortable getting the vaccine, they're more likely to get their whānau, who will then go into the community and talk about their experience. So I think that's the key message, is giving them the correct information.
And if you were talking to your kuia right now, what would you say to her?
Get it. I got it. I wouldn't have gotten it if I didn't think that it was safe, or that I actually got it for my mokopuna and my whānau. So it's to protect everyone else.
Tracy, could you tell us about your team, how many nurses are in it, and how it's going to work at the MIQ there?
I think the focus is more on our MIQ staff today, because they were the ones who got it, so if we could go to them.
Lynette, can you tell us how you felt to be the very first?
Pretty privileged and honoured, but for me it's not about being first, it's all about, having this opportunity to be able to get vaccinated. So I think for me that was important. So we were in it together and we all got done at the same time, so I think we're just very fortunate to be able to have that done.
So were you nervous at that time?
Sorry?
So were you nervous at that time?
Nervous, sorry.
Yeah.
Not to get the vaccine done, maybe more with, the videographer that was there, but getting the vaccine, that was probably the easiest part, so not nervous at all.
So how does it feel? Does it feel like a pain?
No, nothing at all. It was a tiny little prick. There's nothing to be afraid of. It was really easy.
Do you feel like you were given good information, strong, reliable information, and talked through everything before you got the vaccine?
Absolutely. At the quarantine, we're very fortunate to have a team there that we can reach out to. So if a question was just to pop up out of nowhere, I knew who I could go to and get those answers from.
Drew, can you talk us through the process of what happens, because very few people have been through what you've been through?
Well, waking up this morning knowing that you're going to be vaccinated, as Lynette said, it's a privilege and an honour. And turn up to work this morning, I guess a different kind of vibe, because you're not coming to work to do what we're doing our normal work-wise, but you're actually something special today, and something, it's a milestone for New Zealand and for, and for our quarantine sites and all the MIQ. So, just making my way up there and just watching everyone around, just seeing this whole vibe in my head was just focusing on, the special occasion, and I'll take this to my grave that I was the second person vaccinated, and promoting what we're doing here to the rest of the country, to New Zealand, to say, listen guys, do it. It's going to help us, and we'll be number one in the world. So
Is it going to make you feel safer at work? How are you, all three of you, going to feel about going to work at the Jet Park now after this event today?
Feelings are unexplainable, you know. This is just that one extra layer of protection that we have. More so not working there, it's more so going home to our families. So it is a big thing for us working at the facility, but you know, it's a greater deal for us to serve our nation. So yeah.
I think also nothing changes when we go to work in terms of how we do things, and you know, it is another layer of protection, and you know, it's business as usual. You know, we still carry on with the way that we following our processes and protocols. So yeah, it's.
To those of us observing, you know, that plane landed on Monday, here we are on Saturday. It seems incredibly quick. How's it felt for you, and when did you know that today was the day for the vaccination?
I guess we were told earlier in the week what was happening, and that a few of us were being nominated, and like our group general manager, Nicole Lawson, had said, listen, I'm going to put up 3 or 5 of you guys, and we were honoured that she thought of us, and you know, here we are now, and you know, just excited. So yeah.
And did you discuss it with your families? Did you go home and say, you know, it's me, or how did that also
Yeah, I think we did. I mean, well, because Lynette, you've got a family, so how did you?
Yeah, I told them that I was going to be on TV, basically. But, you know, my family, they don't know if they're going to get it done or not. So, but what I'm going to do is today I'm going to go home and I'm going to share my experience with them. I'm going to tell them that there's nothing to be afraid of, it doesn't hurt. But if they had any question, obviously reach out. And, you know, we've got our contacts at the quarantine who we can reach out to as well and get answers for them. So we want to make sure as well that they are feeling confident with their decision that they make. So yeah.
Will they feel happier about you though working there? Will they feel safer when you go home? It's a bit of a strange question, but do you understand what I mean?
Yeah. Well, just like at the quarantine, we have our protocols and our processes in place. When I go home, I have the same thing. I have protocols and processes in place as well. So I go home, I can't hug my family. You know, I've got to go jump in the shower first, get all my clothes off, put that into the laundry. So, you know, those are things that I've got to follow through with, you know, when I go home to my family, because it would absolutely devastate me if I was to take something home with me and, you know, they would catch it. So.
Can I ask you other two as well, what's it been like to kind of shoulder that sort of responsibility and worry over the last few months, nearly a year?
Yeah, well, I mean, at the quarantine site, we treat it as level 4. So whenever we go off site, we still treat it as level 4 because of, I mean, to be honest, I feel safer at work than I do outside in the community, because the community is still being educated. They've got to understand the science, the research, and a lot of them don't know what's been thrown at them. And this, as for all of us here, it's such a different phenomenon. We're not used to something like this. So it's just, yeah, I mean, like I said, the research, you know, the stuff that you get on the media and the guidance and the science, it's just trying to learn all that. But for me, it's been an educational side of things, and it's just trying to put it out to all the you know, the total community, you know, the Pacific Islander, the Muslims, the Maldives, the Indians, the Asians, just letting everyone know that it is absolutely safe and that we're doing this, you know, for us three to do it, is just providing to the community that, hey, you know, if we can do it, then so can you. So.
Do you know when you're going to get your next vaccine?
Yes, 21 days time, so I think it's on the 13th of March. Yeah.
How are you feeling about that?
Looking forward to it. Because I didn't actually even feel it. I thought I was waiting there and she said, I said, is it done? She goes, yeah. I was like, oh, okay, thank you. So please, it's better than when you get the flu injection.
Drew, you talked about when you go out, it being like being in level 4 all the time. I'm not quite sure what extent those restrictions are you have outside the house, but does it ever kind of take a toll on your mental health? Maybe, I don't know, not being able to go out to a restaurant or, you know, those sorts of limitations?
Yeah, it does. I mean, for example, I love my rugby and I couldn't play last year because I didn't want a team to find out where I was working and all that kind of stuff. And I'm just aware of other people. I mean, when you see people coughing and you wear your mask and the stigma you get around that kind of stuff. I mean, especially when people find out we're at Jet Park, the stigma and how some of us can be victimised about it. That's the toughest thing. So what we're trying to do is promote to everyone, to let everyone know that what we're doing is for the country, but at the same time we're doing our job to protect all the Kiwis returning back home, make them feel welcome, and when they leave there, you know, they feel like they've been looked after and all that. So it's a tough one, but until we get through this next level. It's just trying to educate everybody. But yeah, I know it is hard because everywhere you go, you're scanning the QR code. I've got sanitizer in my car, I've got sanitizer in my bag. Even when I go to the bathroom, you just leave a little tissue. It's just being cautious in every way it is, just to make sure that, you know, we've got to lead by example. So
what procedure needs to be done before you're receiving the vaccine, like temperature check or blood check?
Well, every day we have a health check every day, and then once a week we're swabbed. I think my left nose has been violated about 44 times. But yeah, we get all those protocols, and like we get our temperature check, we had our serology test and all that kind of stuff. So everything that we do at the facility is just mainly make sure that we are fit to work. If anyone turns up with even the slightest symptom, a cough, a runny nose, they're sent home. We take every precaution because we just don't want it to bring it through. Because I mean, you can imagine we in the ops room lead everything, for example, and if one of us was to get sick, you take down the whole team, and that's quite a devastating result. So yeah, so we follow every protocol and procedure we put in place with us. So.
How do you feel about the fact that the swabbing is going to continue, that even though you've had the vaccine, things are going to pretty much stay the same for you in your work environment for the time being?
I think it's just more of a backup. I mean, you know, you've got to have a plan A, a plan B, and plan C. So this vaccine, for me, is brilliant, but at the same time, doing your swabbing every week, because you just never know where you may go. I mean, you may touch some kind of surface out in the, and all you got to do is you forget something, you got to go like this and wipe your head and forget about it. So for me, that's a backup plan. So if the vaccine's working, sure, but the swab will also be, you know, for me, it's just more comforting knowing I get that once a week anyway. So
I also, you know, have my parents who are in their 70s in my bubble, so it's important for me that I'm doing everything that I can to ensure that I'm keeping them safe and the rest of my family safe as well. So, you know, having the swabs done every week, I mean, it's my left nose, that's my best, you know, nostril, my left nostril, sorry, that's my best one, and I'm used to it, it's fine, it's nothing, you know, I will do whatever it takes to make sure that I'm keeping everybody that, you know, come into close contact with me safe, so, yeah.
Has this experience changed you all this year, working at the Jet Park, or 10 months, however long it's been? Has it changed you and how you view your life and your community?
Yeah. There are some obstacles. I mean, the other day I was trying to make a booking for my daughter's dental appointment, and you know, they go through that screen test, and you know, you tell them that you work at the quarantine, and they tell you, I'll call you back. So they obviously got their protocols and processes in place, you know, for people that do work at the quarantine. But I mean, you know, if the Tracer app existed before COVID, it wouldn't look any different from what I have today, to be quite honest. So, yeah.
Tracy, no matter how cool people are with vaccines, they're often a bit nervous about the needle. I just wonder how everyone went today.
They actually did extremely well. So it's all about making people feel comfortable. So when you're working in the community, you already know that you need to gauge that person and build a little bit of a rapport before you're going to bring that needle out. So I think that's what the basis is making sure that they're comfortable. We still go ahead, so they did their health check when they came in, which is their usual protocol. So there is the consent forms like you do with regular vaccinations, and then we do go through the regular vaccination questions. And so we do everything as per normal, it's just that we're giving this vaccine instead of your regular one. So they've gone through that process today, and then so not only do they give written consent, but when we sit down with them, we'll talk with them again, then we'll do a verbal consent as well. So it's consented on both ends.
Maybe a couple more questions, please.
Lynette, you said some of your family were unsure about getting the vaccine. How did they feel about you getting it? Were they nervous or anything?
It's not that they're unsure, I just don't know what decision that they've made. Yeah, I think it was more the fact that I was going to be on the news that they were more excited about than getting the vaccine, so yeah.
Have you seen them or talked to them since?
No. No.
Have any of you talked to your families?
No.
No.
Have any of you got any of the minor side effects, like the sore arm or a headache or any of that stuff?
No.
Good.
That's really good. Final question?
Tracy, how daunting a task is it to think of such a big rollout, such a big plan that's now swung into action?
It wasn't really daunting because we weren't looking at a large scale. We were just wanting to make sure that we were providing a safe and environment, and that we were following procedures and protocols because we wanted this to be delivered properly and appropriately. So that was more the focus on, we knew what our task was and we were just trying to make it as safe as possible.
So I think that's a good point that Tracy's made, is of course this is a huge venture over this year, but we're stepping into it carefully and in a measured way to make sure as we scale up, all our systems and processes are good for each phase as we increase the scale. And we're not scheduled to start the wider rollout to the New Zealand population till the second half of the year. And so as we go along, as we have with our response to date, we will be learning and adjusting and improving as we go. We will have hiccups. It won't be perfect. But we have shown over the last year, by being a learning system, we can continuously improve. I do want to thank Lynette, Drew, Lorna and Tracy. I think have been fantastic. And you've also had insights not just into their experience with the vaccination today, but just their experience actually at working in this facility. And I can talk about it from down in Wellington, but hearing from them what it's like to actually serve the country in the way they are doing, I think is very powerful. So thank you for being here today, and thank you for your work every day for New Zealanders. Kia ora koutou katoa, thank you again for being here.
Thank you.